How many people now as a number or as a percentage, how many people now as either a number or a percentage are in the red level of the traffic light system?
1%.
And that 1% figure, is that more than you had anticipated? Is it about online? Are you happy with that level at the moment?
It's actually lower than I thought we might see, so that's great news.
So, we're saying jobs are difficult, and we know that there's higher levels of unemployment than we've experienced. We were at 3.2, we're now at 4.8. I'd just say in the last few decades, 4.8 is still, pretty low levels of unemployment, but we've still got a little bit more where we expect it to rise a little bit to 5.2. But we're doing everything we can now to get growth and jobs moving in the right place. Joe?
Louise, those rural isolated communities where we've seen like mill closures and stuff, for example, and there really aren't other options, what is the expectation there around people having to move before, say, disciplinary proceedings kick in?
Yeah, so the point I want to make is the sanctions aren't applied if you can't find a job.
Correct.
They apply if you're not taking steps to find a job, and that's a really important distinction, particularly when we do know it is challenging out there.
And for geographical location as well, though, because there's the expectation that you look for work outside of your town, for example.
If appropriate.
And to be clear, though, there wouldn't be any disciplinary measures for people who can't find work within the community that they already live in because of work closures.
Well, there is also assistance to help them relocate to where a job is available.
She said that a lot of her classmates have family and kids, and cost can be an issue with moving into rural areas. She also says that some nurses are applying for non-nursing jobs or looking overseas. Isn't that a waste of knowledge and a waste of enthusiasm of people who want to help others within our healthcare system?
Oh, look, and as I said, we've done such a great job in 12 months after having had massive worker shortages for the previous 6 years. The fact that we've actually got 2,900 extra nurses into the system is absolutely fantastic. But as I said, we've got gaps in the healthcare system. But we've also now put in place recently incentives to, a $20,000 top up to make sure that actually those nurses can get connected to all those employers. And yes, they may need to move, but lots of folk across New Zealand move to secure work and to secure a job, particularly a starting up graduate.
Last year, during the nursing shortage, National made an election promise, offering new and recently registered nurses and midwives up to $4,500 a year towards student loan repayments, which would be $22,500 each over 5 years.
Are you intending on keeping that promise?
Well, we'll continue to look at that, but what has changed in the last year, just to give you a feel for it, is there are 2,900 full-time equivalent nurses in the system extra.
But you're not giving any firm
I can't give you a firm commitment around timing, but I can say that issue, that program is still something that Shane Reti will work his way through.
Nurses are worried it's yet another blow as they already face not having enough available jobs.
It's another broken promise, and it's showing the level of disrespect that this current government has.
It's still a live proposal on the table as to when it gets action and how it does.
How quickly will that happen?
He'll work his way through that. Well, right now there's some other more pressing issues that we have to deal with.
I think there's a significant amount of our student nurses who will be leaving to Australia as soon as they possibly can.